Hey everyone, and welcome. Today, we're diving into something that really separates the experts from everyone else in medicine: how to truly interpret clinical data. And I'm not talking about memorizing endless numbers. We're going to completely change how you look at patient vitals, turning them from just numbers into actual stories.
So, have you ever just felt completely buried under this mountain of clinical data? Endless lists of blood pressure readings, heart rates, lab values. It honestly feels like you're trying to memorize the phone book, right? Well, here's the thing. The secret isn't to memorize more. It's to think in a completely different way.
Okay, so here's how we're going to tackle this. First, we'll cover the one golden rule you need to know. Then we'll decode the vitals themselves. After that, we'll see how they come together to tell a story. We'll add in the crucial power of context. And finally, I'm going to give you a killer strategy to just crush those exam questions. Let's jump in.
All right, first up, beyond the numbers. This is where we'll lay down the one golden rule that's going to reframe your entire approach to this stuff.
And this is it, right here. Success depends on recognizing patterns rather than memorizing numbers. Just let that sink in for a second. This is the whole game, right here. You have to stop trying to memorize isolated numbers and start training your brain to see how they connect. Seriously, this mental shift is the foundation for everything else we're about to talk about.
So, if it's all about patterns, how do we even start to spot them? Well, first things first, we've got to know our building blocks. So let's do a quick fire round and decode the core vitals.
Okay, let's just quickly run through the big three. First up, you've got blood pressure. We all know the classic 120/80. Now, if it drops too low, that's hypotension. We're worried about shock, where the body just isn't getting enough blood flow. Simple enough. Next, heart rate. The sweet spot is 60 to 100 beats per minute. If it gets too fast, that's tachycardia, and it can be a sign of anything from an infection to hypovolemia, which just means low blood volume. And finally, respiratory rate. Normally, that's about 12 to 20 breaths a minute. A really fast rate could point to a lung issue, yeah, but it could also signal a much bigger problem, like the body becoming too acidic.
Okay, now this is where the magic happens. This is where we stop looking at individual numbers and start weaving them together. This is the moment the vitals stop being just data points and start telling you a really powerful story about what's going on with your patient.
So here's our first classic pattern. You see low blood pressure, hypotension, and you pair that with a really fast heart rate, tachycardia. What's the story here? It's simple. The body's in shock. The heart is just racing, desperately trying to make up for that failing circulation. In the real world, this is a 5-alarm fire. And on an exam, this is a giant, flashing neon sign pointing you to the answer.
Okay, but what happens if we just tweak one of those variables? Now, we still got that low blood pressure, but this time it's paired with a slow heart rate, what we call bradycardia. This tells a totally different story. The heart isn't trying to compensate here, it's actually failing on an electrical level. This pattern points you away from simple shock and straight towards a diagnosis like a heart block. See? Same low blood pressure, but a completely different story.
And hey, let's not forget about the breathing rate. A fast breathing rate isn't always about what's happening in the lungs. You might see a patient breathing really fast and deep. That's called Kussmaul breathing. When you see that, you should be thinking their body might be trying to blow off excess acid. It's a classic sign of something called metabolic acidosis, which should immediately make you think of conditions like DKA or diabetic ketoacidosis. The way they're breathing is the clue itself.
Now, these patterns are incredibly powerful, but they're pretty much meaningless in a vacuum. So our next section is all about the power of context. You see, a single reading tells you almost nothing. The full picture, though, that tells you everything.
So here are some of the critical rules of context you've got to remember. First, always look at the trend, not just a single snapshot in time. A blood pressure that's slowly creeping down over a few hours, that's a way more concerning. Second, the patient's age matters a lot. A BP of 100/60 might be totally fine for an 85-year-old, but in a 25-year-old, that's a huge red flag. And finally, you have to look beyond the numbers. Is the patient confused? That's a massive warning sign for shock, even if their blood pressure looks okay for the moment.
And context helps us dig even deeper to figure out the why. For example, if you see a fast heart rate but no fever, you should probably think less about infection and more about something like blood loss or anemia. A patient who just had surgery and suddenly spikes a fever, yeah, infection is way up there on your list. And check out that last point. It's a little counterintuitive. A low temperature in a patient with sepsis is actually a really bad sign. It predicts a much poorer prognosis. This is that next level pattern-based thinking we're aiming for. Okay, let's bring this all home with our final section. This is a super practical, high-yield tactic that you can use to just absolutely nail those tricky clinical vignette questions on your exams.
So here's the strategy. It's simple. Find the odd one out. When you read a clinical scenario in a question, you're going to have an expected pattern in your head for the most common conditions, right? Well, the vital sign that breaks that pattern, that's your biggest clue. It's the one piece of the puzzle that just doesn't seem to fit. And almost always, that's the key to the whole thing.
All right, let's try it out right now. You've got a patient who comes in with a blood pressure of 90/50, okay? So you're thinking, maybe shock. Their respiratory rate is 18, pretty normal. But their heart rate is 50, just 50 beats per minute. So based on everything we've just talked about, which one of those vitals is the odd one out for a typical state of shock?
It's the heart rate, of course it is. A patient in classic shock should be tachycardic. Their heart should be racing, not crawling along at 50. That slow heart rate is the odd one out, and it's basically screaming that the problem isn't just low volume, it's probably a primary electrical issue with the heart itself, like a heart block. See? Finding that one little inconsistency unlocked the entire diagnosis.
So, if you take just one thing away today, let it be this. A number tells you what is happening, but a pattern tells you why. And that why is where the real diagnosis happens. So the next time you look at a set of vitals, don't just read the numbers. Read the story. What story are you going to uncover next?